Hello, guys. My name is Cindy James. I study at St. Thomas University. I'm taking nursing 509 to this June 23rd, 2022. So I would like to go over myself. I like to go in every single detail so I don't miss anything about my patient. My patient name was initials is CO. Her age is 68 years old. The gender of this patient was female. Her race was Hispanic American. The patient stated that she's been throwing up and puffing a watery stool after she took some food that was not basically well prepared by a restaurant. Who have that this food, of course, was now prepared, adequately prepared. Um, so I always like to have everything about the history of everything that she's having and she's presenting at this time. This Hispanic woman, who was 60 years old at this time, seemed to be in a good health up to the time. She already suffered from nerve. She has had uh, about a lot of MSs and diarrhea in the past days. She claims in the morning, before she got unwell, she ate some of the pork, kales, and some rice that had not been cooked, that had been cooked by the restaurant. Over the over the previous 12 hours, the patient experienced several abdominal pain from 0 to 26. About 3 to 5 hours after eating, she started experiencing the symptoms that she has been having, which is diarrhea, abdominal pain, and vomiting. She claims that what helped her a little bit is the proper and warm water are the only things that can help her with this pain. She hasn't been trying anything over the counter. Her discomfort is most severely in the belly area. When I touch her, she feels a lot of pain. So I always like to report and check everything about my patient. This patient report that she never had a food allergy, no history of pollen or any other environment exposure that has been reported by the patient. However, she reported that she's an allergic to amoxicillin. She experienced skin rashes, high fever, itching, runny nose, and watery eyes when she takes amoxicillin. The symptoms had worsened twice before she knew that she had an allergy to the drug. And she was assisted to the neighboring hospital where basically they help her with that. This patient is fully immunized. Basically, she has everything updated. Um, According to the data that she had an instruction in 2017. She reported that she had regular dental examination, including every 6 months. She has asking her her medical history. She has diabetes type 2, morbid obesity, hyperlipidemia, and high blood pressure. There is nothing that I can see. She's been help basically she's been helping herself. She's been trying to make some diets and everything. She takes her blood pressure medication and she helps herself to become better. No surgery, as she told me. The patient is married. I like to always know about the social history of the patient. The patient is married and lives with her school bus driver husband. She is retired social worker who works at a clinic where she always wears a seat belt. She reports bad eating habits and healthy lifestyle. She does not smoke. She does not engage in any regular physical activity. She lives in a single family residence. She has no recent history of traveling outside the nation. She doesn't have any pets in her house. The family history. The patient has to live indoors and a husband. His sister has a history of IBS. Her father died from surgery, from suffering from diabetes, hypertension, and prostate cancer. So I always like to go every single, I like to review the system so I don't miss anything. The patient denied weight loss or fever or chills, weakness or fatigue. The patient denied vision loss, double vision, blurred vision of yellow sclera. A review of the ears, nose and throat had the patient report absence of hearing loss, sneezing, congestion, running nose, or the patient denies skin rash or itching. The patient further denied chest pain or the chest discomfort. The patient denied coughing, shortness of breath. She accepts anorexia, nausea, vomiting related to the disease. She also accepts abdominal pain, also denies joint pain, stiffness, back pain, and she accepts full range of motion. Hematology-wise, patient denies any bruising or bleeding. Psychiatric-wise, she accepts that she has some anxiety. Endocrinology-wise, she accepts fluoride and polydipsia. And allergies, no noted or nothing that she reports. The general orientation of the patient is based on person and situation as well. Neck movement was flexible, muscle strength was normal, pulse of the patient was extremely was present. She has no edema in the extremities. The area of the major concern was the abdomen. The abdomen is slightly tender, flat, and soft on palpitation. The reports of the scale to 0 to 10 is 6 on the palpitation of the abdominal part, upper abdominal part. There is less pain of palpation in the lower abdominal quadrant. She rates the pain on the lower abdominal quadrant is 2. The patient guards the abdomen. Bowel sounds are hyperactive in the four abdominal quadrants, the splenectomy and organomegaly, not the pneumothorax. My diagnosis stays in differential diagnosis. Acute viral gastritis secondary to food poisoning is the first diagnosis for this patient. Is considered the primary diagnosis since the condition is related to sudden onset abscess of the restaurant. To repose abdominal tenderness, loss of appetite, negative flu, or CD results. The condition is associated with MPD, nausea, vomiting, diarrhea, in which the patient reports episodes of vomiting diarrhea. The absence of the fever also makes virus gastritis to be primary diagnosed. Bacterial gastroenteritis, the condition is considered in relation to the history of diarrhea. Is the rule out by the negative stool sample test and absence of fever. The condition is considered based on abdominal discomfort and history of condition of patient. The condition is ruled out by abdominal ultrasound and X-ray. The absence of the pain during the bowel movements also rules in the condition. So I always recommend the patients to have the abdominal X-ray, ultrasound if it's needed, and a stool sample to send it to the lab, right? My treatment and my education. The patient might be prescribed with antiemetic to control the vomitings and occurrent nauseated episodes. For abdominal discomfort, she can use Tylenol. She can also use probiotics to help restore the normal flora and the GI system. The blood diet is recommendable until her system is relieved. The patient diarrhea is manageable through the rehydration and maintenance of electrolyte balance using setting. The patient is educated to ensure that the food that she eats is well prepared to avoid cases of food poisoning. She's also advised to continue eating healthy and take plenty of fruits and fluids to help her recovery. She's recommended to perform the physical exercises as prescribed due to the other health conditions. So basically, I always try to give education of every single review system that I gave her, so she goes with more educations than she had before. In my role of education, as we know, as a nurse practitioners, is to keep our patients safe. So as my goals are met, is by evidence of the diseases, diarrhea, minimize risk of infection, maintain good skin condition, improve hydration, and nutrition intake with all the teaching given. I would like to have this patient back in 2 weeks. References are attached to this PowerPoint if you guys would like to see. I hope you guys like my PowerPoint. I did it multiple times. So I did it on different in my book. So I hope I got this one right. Thank you. Have a good night.